Welcome to EPH Insights. Ebola virus disease remains a significant public health challenge, known for its high fatality rate and rapid transmission. In this video, we will explore its causes, symptoms, transmission, and prevention strategies. Stay with me as we delve into the science and global response to Ebola. Ebola disease is a severe and often fatal illness caused by infection with one of the Ebola viruses, primarily found in sub-Saharan Africa. Although rare, the virus spreads to humans through contact with infected animals like bats or non-human primates and can further transmit between people through bodily fluids. Without medical intervention, Ebola has a high mortality rate. It affects both humans and non-human primates, making it a significant zoonotic disease with serious public health implications. We can see the classification of Ebola disease. Ebola belongs to the order Mononagavirales. This tells us it's a single-stranded RNA virus with a non-segmented genome. Within Mononagavirales, Ebola is placed in the Filoviridae family. This family is known for viruses that cause hemorrhagic fevers, characterized by severe bleeding. Ebola is part of the Ebola virus genus. This is where the specific types of Ebola are differentiated. Under Ebola virus, we see several species listed. These are the distinct types of Ebola virus, including Bundibugyo Ebola virus, Reston Ebola virus, Sudan Ebola virus, Thai Forest Ebola virus, and Zaire Ebola virus. Ebola viruses were first identified in 1976 during two deadly outbreaks of hemorrhagic fever in Central Africa. The first occurred in the Democratic Republic of Congo, near the Ebola River, giving the virus its name, while the second was in present-day South Sudan. Initially thought to be a single outbreak, scientists later confirmed they were caused by two distinct viruses, Zaire Ebola virus and Sudan Ebola virus. Ebola viruses persist in the environment by spreading between hosts, including wildlife. Infected animals, such as bats, can transmit the virus to other animals like apes, monkeys, and even humans. While some infected animals show no symptoms, non-human primates can develop severe illness similar to Ebola in humans. Ebola is initially transmitted to humans through contact with infected animals, such as fruit bats or non-human primates like apes and monkeys. Once a person is infected, the virus spreads from human to human through direct contact with blood or body fluids, such as saliva, urine, vomit, or semen of an infected person, whether they are sick or deceased. Contaminated objects, including clothing, bedding, needles, or medical equipment. Semen from a recovered male patient, as the virus can persist in certain body fluids for an extended period. The highest risk of Ebola infection is among healthcare workers and family members who care for infected patients without proper infection control measures. Direct contact with bodily fluids increases their chances of getting sick. However, for the general public and travelers who have not been in close contact with an infected person, the risk of contracting Ebola remains very low. Ebola can persist in certain body parts even after recovery, including the eyes, testes, and central nervous system, posing a risk of transmission. In healthcare settings, outbreaks can escalate rapidly if proper infection control measures are not followed. Healthcare workers must use protective equipment and adhere to strict sterilization protocols. The virus can survive on dry surfaces for several hours and in bodily fluids for days, making proper cleaning and disinfection essential. Using hospital-grade disinfectants on surfaces and medical equipment is crucial in preventing the spread of Ebola. Ebola symptoms typically appear 2 to 21 days after exposure and often begin with fever, severe headache, muscle pain, and fatigue. As the disease progresses, patients may experience vomiting, diarrhea, abdominal pain, and unexplained bleeding or bruising. In severe cases, organ failure and shock can occur. Ebola infection begins with exposure to the virus, either through contact with an infected person or animal. The incubation period lasts 2 to 21 days, typically 4 to 17 days, during which the person feels fine and is not contagious, though the virus is multiplying in the body. The dry phase starts around day 4, marked by mild symptoms like fever, fatigue, and sore throat. At this point, the person becomes contagious. By days 7 to 10, the wet phase begins, with severe symptoms like diarrhea, vomiting, and bleeding, making the person highly contagious due to a high viral load. In the late stage, death often occurs between days 7 to 10, when the virus load is highest, making the deceased individual extremely contagious. The U.S. Food and Drug Administration, FDA, has approved the Ebola vaccine Ervebo for preventing Ebola disease. This vaccine has been proven safe and effective, but it only provides protection against the Zaire Ebola virus species. While Ervebo is a major breakthrough in Ebola prevention, continued research is needed to develop vaccines for other Ebola virus species. In this slide, we discuss two types of treatments for Ebola virus disease, EVD. First, Inmazeb, approved in October 2020 by the FDA, is a combination of 3 monoclonal antibodies that work together to neutralize the virus. Second, Ebanga, a single monoclonal antibody, also approved by the FDA, targets the virus but works with just one antibody. Apart from these treatments, supportive care plays a crucial role in improving survival rates. This includes administering fluids and electrolytes to prevent dehydration, medicines to stabilize blood pressure, and treatments to manage symptoms like vomiting, diarrhea, fever, and pain. In some cases, blood transfusions may also be necessary to help patients recover. The given map shows the distribution of Ebola disease in the continent of Africa since 1976. The Zaire species is having more outbreak among the countries followed by Sudan, Bundibugyo, as well as Thai forest species. This slide outlines key organizations in the global fight against Ebola. The Global Ebola Response Coalition (GRC) coordinates efforts worldwide. The United Nations funds the response through the Ebola Response Multi-Partner Trust Fund. The World Health Organization (WHO) provides technical support, and the CDC supplies vaccines for the Zaire Ebola virus. These groups work together to manage and control Ebola outbreaks. Diagnosing Ebola can be challenging early on because its symptoms, like fever, are similar to other illnesses. Several tests are used to confirm an Ebola infection. 1. Antibody capture ELISA detects antibodies against the virus in blood. 2. Antigen capture tests identify Ebola virus proteins in the blood. 3. Serum neutralization test measures the ability of blood serum to neutralize the virus. 4. RT-PCR assay detects viral genetic material in blood samples. 5. Electron microscopy visualizes the virus directly in samples. 6. Virus isolation by cell culture grows the virus in lab cultures to confirm its presence. These tests help confirm an Ebola diagnosis and differentiate it from other diseases. Coming to the prevention of Ebola disease: wash hands often with soap. Cook food thoroughly. Seek medical help for Ebola symptoms, fever, headache, etc. Tell others about Ebola. Call hotlines for help/questions. Don't touch sick or dead Ebola patients. Touch their clothes or bedding. Touch their bodily fluids, vomit, blood, etc. Touch wild animals, monkeys. Eat bushmeat or fruit eaten by bats. Together we can stop Ebola. Stay informed, stay protected, save lives. Thank you for watching. Please do subscribe my channel and wait for my next video.